I'm going to be administering a feeding through a nasogastric tube today. So the first thing I want to do is make sure that I verify my physician's order for the type, concentration, the volume, route, the rate, and the frequency. So I then want to get my equipment and I want to make sure that it's not expired. So once I've gathered my equipment, check my expiration dates, I'm going to go ahead and wash my hands, and I can identify my patient using two different means. And I'm making sure that all of my equipment is assembled before. So now I'm going to go ahead and I've identified them using their name and date of birth, checking their wristband and comparing it to their documentation. And I'm going to go ahead and do their abdominal assessment. I'm going to listen after I inspect, so I'm inspecting the abdomen and looking for any signs of distension or problematic areas. And I'm going to go ahead and listen to the bowel sounds in each quadrant for at least 2 minutes. If I don't hear bowel sounds, I'll listen for at least 5 in each quadrant. And now that I've done the abdominal assessment, I want to put them up at least 30 degrees, but hopefully 45 degrees. So now that they're up 45 degrees, I'm going to go ahead and don my gloves, because we already have our feeding tube in, but now I want to verify placement. So I'm looking at the markings on the tube, and I'm also going to measure outside the tube outside of the body to make sure I compare that with the documentation that it is in fact in the right place. And we're going to go ahead and take 30 mils of air and insert this into the tube, because I'm going to go ahead and aspirate and clamp my tube. And I'm going to put this on my pH strip and assess. And now that I see that that is 4.0, I'm going to go ahead and know that that is stomach contents. If it were more like 6.0, we would think it was in the lungs. I'm also making sure to observe the color and consistency of the aspirate. So now that I know I'm in the stomach, I'm going to go ahead and aspirate all of the stomach contents. And you can measure that in the tube or use the graduate. And then I'm going to return the portion of the aspirate per the hospital's policy. If I'm doing an intermittent feeding, I want to do this before each feeding. If I'm doing a continuous feeding, I want to do it every 8 hours. So now we can go ahead and clamp our tube, and I'm going to draw up 30 mils of sterile saline with a new syringe other than the one that I aspirated with. Unclamp the tube and go ahead and flush. Clamp it back. Now I'm going to go ahead and wash my hands. I do want to make sure that whenever I'm using fluid to flush a tube, that if it's a neonate or pediatric patient, to use the lowest volume possible. So I'm going to go ahead and take off my gloves, wash my hands, and put on new gloves, because we're ready to administer our feeding. So if I'm using an open system, which you see right here, the first step is to make sure that we label the bag with our patient demographics and the type of feeding, the method, the date that it was prepared, the date and time, the date and time that I actually hung the material and make sure there's a warning. And we're making sure these labels are on both the tubing and the bag. So you can see our IV warning here, patient demographics. You then want to make sure that you hang this at least 12 inches above the patient's stomach. And we're going to go ahead and make sure it's clamped so that it doesn't go anywhere. And we're going to prepare our feeding by making sure that we check the expiration date and that we clean the top of the tube, the top of the feeding. And we're going to go ahead and pour it into the bag. We will then go ahead, and if we're manually priming this, we'll just let the fluid flow through out into the trash can. If you are using a pump, then you can go ahead and hit the prime button and go ahead and let that prime through to the bottom and clamp the tubing. So now we want to attach the feeding setup to the tube, and once we've connected it to our tube and to our feeding system, we're going to go ahead and set the rate, and you want to set the rate of the feeding low and start slow and add gradually. So we'll go ahead once we set the rate and unclamp our feeding. And so once we've done the feeding, we'll go ahead and clamp and disconnect. And we're going to go ahead and flush with 30 mils of sterile water. And once we flush the feeding tube, we'll go ahead and cap it, and we'll also make sure we flush the bag and the tubing. And go ahead and make sure this is clamped. And once everything is disconnected, we'll make sure we keep this patient up for at least 1 hour. So if you're using a closed system, that's what you see here. You're going to check the expiration date and make sure you label the feeding material and your tubing that's connected to the patient. These are a little different because you have to spike the bottom of the container with your tube. So once you've inserted your tube in there, you'll go ahead and prime the same way, either into the trash can or through using your pump. And so you'll go ahead and connect this feeding to your feeding tube here and make sure it's to your pump. Set your rate, and then once you've completed your feeding, you'll go ahead and disconnect from the tube and clamp. And that's when you're going to flush with 30 mils of sterile water. And then you're going to go ahead and cap your tube. Once you've capped your tube, it's important to remember that anytime you're doing a feeding, to trace all of your tubes from the patient to the actual pump to make sure you know which connections you have. And it's also very important to make sure that all of your bags are labeled, and it's a good idea to also label your tubes as well.